I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Our guest today is Ernie McNutt. Welcome, Ernie.
Hi, thank you. How's it going, Craig?
Going great. We're coming to you today from the New York Alliance for Inclusion and Innovation, and I understand you're a member of this organization.
Yeah, that's right.
Yeah.
Yeah, I mean,
talk about it.
Sure. New York Alliance for Inclusion and Innovation is a trade organization for really provider agencies who are in the IDD space in New York.
So what do you do in this field specifically?
Well, I work for a care coordination organization.
CCO, I think they call it, right?
AKA CCO, right?
Yeah, great.
So the CCOs are organizations that were created in 2018. It was kind of some legislative changes, and New York State came along to create them. And they are care coordination organizations only doing care management for people with intellectual and developmental disabilities, right? IDD, and who are authorized for services under New York State. There's a section of New York State that serves people with disabilities called OPWDD, which stands for Office of People with Developmental Disabilities. And so under that, in July of 2018, they were, this new position was created, and essentially these new companies were created.
So when you say care management, what does that mean?
So care management is really the independent advocate for the person to get really what they want and need in life. And it could be, services offered by New York State under OPWDD. It could be things they want from their community, in their community that they're looking to get, they don't have. It could be some of the basics of life. It could be a job. It could be their own apartment. It could be meeting friends, all kinds of things.
Healthcare?
And so healthcare is definitely a part of it because this population is all on Medicaid. And, as we know, people with disabilities, there's a lot of disparities with access to healthcare. It's been very challenging.
Lots of disparities all the way around. Yeah. And that certainly is a challenge. And so one of the things that your care managers do is help them get access to healthcare in general and maybe connect them with people that can help meet their needs.
Right. I mean, it's a partnership, right? Your healthcare is a private matter between, it's not like we're calling the doctors and saying like, what did you tell Jimmy yesterday, right? And so we work primarily with the person and with their permission through consents and all that. Then we connect with those healthcare providers. And really what we want to do is help people keep on track. Hey, let's take a healthy person, right? Hey, you're due for your annual physical this year. Did you go, right? We just talk to them, right? And then, I went. Oh, that's great news. Were there any follow-up recommendations? Did they say, I want you to go get this test done, or I want you to see this specialist? Do you need help with that appointment? Do you need help with transportation? Where is the appointment? Who is the provider? Would you mind me calling? And let's make sure you know the date and time of your appointment. We'll coordinate and discuss and make sure that all of that happens. So we're not going to take them on the appointment necessarily, but we'll arrange, the logistics. How are you going to do it?
You're providing support for that person to do what they both need and want to do in their own lives.
Yeah.
How long have you been doing this?
So I came into the organization in November of 2018. Before that, I worked for a provider agency that was doing a lot of services for people with disabilities, and not in the medical realm, but in the social service realm. Job placement, day programs, residential, all those kind of services. But I was really interested in the care management side because I just feel like it's very dynamic and growing, and it's a new way of working with people that New York State really didn't have up until that time.
So how did you get into this field in general of supports and services for people with intellectual and developmental disabilities?
Okay, now we're going way back.
All right, that's okay. That's good.
So this is back to when I was in college, a million years ago. And there was a group home in the town, and they were looking for somebody to do recreation. And it fit with my schedule, with my classes, because it was kind of in the early evening. So I started working in a group home for people with disabilities and was kind of the recreation specialist. Come in, do fun things, organize activities. It led to what we would now call community habilitation, meaning like taking people out and go shopping, go to different places, different locations that they were interested in. And I really saw, how people with disabilities lived and how kind of different but the same that they were with everybody else. And I just was really hooked by the people and their needs and their lives, and I felt like I could really, make a difference.
So you said their lives are different but the same.
Yeah.
Expand on that a little bit.
Sure. Yeah. I mean, so they needed to, at that time, they were living in a large group home, and everybody had a roommate, and somebody was cooking and, helping with cleaning, and they had chores, and they had jobs, and they had different activities around the house, because they weren't able to live on their own. They weren't able to have an apartment or have a job, and so there were a lot of differences, right? But at the same time, they were also just regular people. They wanted to go to a baseball game. They wanted to go shopping. They wanted to have some money in their pocket so they could go buy some things that they like to buy.
The same things that everybody else wants.
Exactly. Exactly.
Yeah. And that's one of the neat things I think about this field is what we are doing is having or helping people to have more independence, to be able to have a life that they kind of craft or at least have some say-so in what happens in their lives, and some input into it. Sometimes this field gets criticized for being a little too heavy about we need to do what's best for this person. This is what they should do, so let's have them do this and let's have them do that. And none of us want to live a life that's dictated to us.
Right.
So it sounds like you've got to always be working to find that balance, because people do need different levels of support, right?
Right.
So you've got to figure out how much support does this person need, and help them figure out, again, I guess just the balance between too much, too little, and living a life that's independent and integrated in society.
Yeah, that takes us back to the care manager's role with the life plan. So there's some assessments that we do before the life plan, which is really just questions, right?
Let me back up and ask you, what's a life plan?
All right, so a life plan, very important. Yeah. It's exactly what you were saying. How to have an integrated life in the community that's of your own choosing, that you're really the driver of, put you in the driver's seat. And so that's one of the main jobs of the care manager, right? We're an independent advocate for the person, but what are we advocating for? What are we trying to get? Well, let's write it down. Let's write down the things we're going to work on. So let's make a plan, and then let's enact the plan by going out and finding the services, be it healthcare providers, be it social service providers, community providers, activities, fun things that you want to do, that you want to accomplish, or things you want to change, right? Things that you want to change in your life so you can improve your life and do better. So we're going to put all that in a plan. The care manager is responsible for writing the plan and then connecting the person to providers. Connecting meaning, like I said, it could be a medical provider, it could be a company or an organization that specializes in this area. A person wants to learn something new. Well, let's find a class, right? So that would be a provider. They provide classes. Could be a whole variety of things. But there's a world of services out there and a world of providers out there that care managers sometimes research or find, learn about, dig into, very individualized for the person. But ultimately, it's the providers that are actually going to do the work. And it's the person that's really going to be making the changes. And the care manager is just helping them come along, helping them move along, through the process.
I would think that would be very satisfying in a lot of ways.
When we change lives and we see people's lives change for the better, it's deeply satisfying. Absolutely.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Do you have a story or two that you can share that was pretty impactful to you in your work in this field?
Well, obviously we see people sometimes at their worst, and we help them get to a much better situation, and sometimes people are. Well, as one example recently was a person who was really living independently and not able to. It was too much for them. They really wanted to be independent, but it was really too much. And they were not following up with their medications. They weren't getting to appointments. They were not connecting with services. And they were very alone. They weren't, kind of connected with peers or friends, weren't able to do things, and their family, and she really rebelling against her family, right? It was a war of will against her family. And through the work of the care manager, it took a long time, but really being very patient, very person-centered, taking things step by step, talked with her about group homes and tried to find one where it was people her own age, similar interests. And, it's mutual. A person has to be interested. They have what we call screenings, the screening process. We're going to screen, we're going to talk, we're going to maybe visit, maybe stay for dinner, step by step, along the way. But I was really impressed recently to read about how this person who was really struggling on her own was very happy in the group home, had a group of friends, they were going out, they were making decisions about what they wanted to do with the support of the staff, and also doing things on their own. And it was a complete transformation of this person from where they were, let's say, a year before. So it was really remarkable.
So that's one success story of probably hundreds or thousands that
absolutely
you could share with us, because the work you do really does impact the lives of people, and that's something that we probably should encourage other people to consider when they're looking for careers. I think there's so many different career opportunities in this field where some of them maybe pay better than others. None of us are really going to get super rich in this career. But we might become rich in experiences and the feelings that we have when we do something that helps the life of someone else.
Absolutely.
So I'd like to do a little thing called 3 and 3. So it's 3 things that you'd like to share with listeners related to this field in any way whatsoever. Whatever, a little piece of advice, a little anecdote, whatever you think. Maybe something that people can do in their own lives that can improve the world of support services, health, wellness for people with intellectual and developmental disabilities. So pretty broad. And I'm not going to hold you to it too much, but I'd love to hear 2 or 3 things that you'd like to say. Well,
I think that we're really in a time of change with the field. We were talking before about the feeling like people with disabilities like the same, some ways very different, in some ways very the same. And I think we're at another point of change in our field where we're really looking at differences instead of disabilities, right? And that's I think it's important for people to see not a person with a disability, but a person with differences just like they have differences. And we're all different. We're all unique people. And I think that people really, should not, kind of put people in a box, and say, oh, that's a person with a disability. I shouldn't approach them or talk to them, or I don't understand them. No, you can, just kind of take a kind and, gentle approach with people and have a conversation or have a discussion and, don't feel shy basically about, approaching or talking to someone with a disability, many times with the parent or with the family. And it's easy just to say, talk to the parent or not talk to the person with the disability, but just say hi, say hello, and kind of see what happens.
See them as a person. Treat them as a person, and talk to them as a person.
Right.
Yeah. First. Yeah. That's certainly something that we can all do. In our lives.
All right.
What else you got?
So one. I got 3 now. For people that are kind of, thinking about the field or thinking about, the field of people with disabilities, volunteer, right?
Great advice.
There's wonderful opportunities all the time with provider agencies, with Special Olympics, with, a number of opportunities and organizations to get to know people. sometimes summer camps are also an incredible opportunity to work with people with disabilities. Doesn't have to be, that could be a job, a summer camp job, but there's always, opportunities to learn about the population and see people as people and understand kind of what's important to them, what their world is about, what makes them different, what makes them the same, and how interesting many times you can have such a nice conversation with people or really learn about them and their backgrounds and their histories and, kind of the struggles that they went through, and really see them as people who have so much right with them, more right with them than wrong with them.
Yeah, we tend to see the disability first.
Yes,
can't be done first.
Right.
And there's so much that they can do and participate in and be a part of, and sometimes it's our own or something within us that doesn't facilitate that happening, that doesn't make them feel included. So we can certainly do better with that.
Right. Any little difference or any little odd thing, people kind of shy away. But it's, just recognize it as this is just a difference, and this is just a different way of expressing, emotions or feelings.
I've often used, IDD, intellectual developmental disabilities. Let's change the last D to differences. Intellectual and developmental differences. Right. And we all have them. We all have them to different degrees.
Yeah.
Anything else you want to tell everybody or talk about today?
I just, we were talking before about the care manager role. I really see the care managers as people who, they really, in that job, few jobs give you an opportunity to really change lives, right? People say, I want to make a difference. I want to change lives. And people can be kind of part of the puzzle, right? Sometimes, but care manager, and honestly, the people working at those provider agencies who are really, in the work day to day, that partnership between the care manager and the provider agencies really gives that person in that job a chance to really make a difference in people's lives, and to do it for many people, and to teach other people and show other people how they did it, which makes a pathway for future care managers and people to change those lives. So it's a wonderful opportunity to both change lives and kind of show the way of how it's done for other people. So I think there's a lot of positives in this role, in this capacity as care manager.
Well, that is wonderful. Ernie, thank you so much for taking the time to be a part of the podcast today and sharing your insights and wisdom. More importantly, thank you for the work that you do in this field that touches the lives of so many.
Oh, thank you. Thank you, Craig. Appreciate it.